Good afternoon or evening, depending on where you are joining us from. My name is Melissa Faulkner. I am the VP of Marketing. We are the Digital Health Hub Foundation, a digital health accelerator at the Worldwide Center for Healthcare Innovation. Now in its sixth year, our awards program is dedicated to identifying the most transformative, disruptive, and innovative companies shaping the future of healthcare. This year, out of over 1,500 applicants, 300 were named quarterfinalists, and we've narrowed it down to 150 exceptional finalists. Today, we are proudly presenting our 5 best in class and our 9 rising star finalists in the home health diagnostic category, leaders and companies who are truly revolutionizing this space. As a reminder, this session will be very fast paced as we have 14 companies that present, but this is only a small taste of what these companies have already shared as part of their application. If the audience has any questions, please feel free to drop them in the chat and we'll try to get through them. I would now like to introduce Mark Goldstein, our chairman at the foundation, as well as the category, or as well as our executive producer who'll be hosting this session.
Thanks, Melissa. Hey, guys. This is one of my favorite sessions, so I'm really glad to be here. We've got 2 groups of companies. We've got what we call our best in class, which are more mature companies that typically are later stage, have later stage funding, have tens of thousands of clients, and are really starting to take over the world. And then we have our rising star companies, and these are like these are the cool companies. These are the ones that are coming up. These are the ones that are really making a difference, and these are the ones that we all should be really paying attention to. So we have awards in both categories. We're going to split them up today. So we're going to first focus on our best-in-class companies and then get to our rising stars. Before I introduce you to the amazing Paul Grand, which should come shortly, why are we doing this? We do this for our judges. A lot of you judges are online right now. Most people are going to consume this actually on demand. They're not online. We just have learned our lesson over the years. Everything's on demand. And we're creating and using some of these clips for our grand finale at HLTH in Vegas. So I'll be back. But with that, I'm going to introduce you very quickly to Paul. Paul Grand.
Hey everyone, nice to see you. I'm Paul Grand. I'm the CEO of MedTech Innovator, which is the world's largest healthcare accelerator. We are a global program. We have companies from all over the world. And our mission is to make sure that these innovative technologies actually reach patients and with as much value as possible. We want to make sure these technologies not only reach patients, but succeed, that they can be purchased, that the ecosystem is able to not only need these things, but actually adopt them and be successful. So that's what we're all about. We've been working with this particular program for years with Mark and others here to make sure that these types of innovations get the visibility they need. So we're thrilled to be part of it, and I'm happy to be here as a category champion.
I would now like to introduce Antara from our content partner, Avia, to set the stage for where we are in the home health diagnostic space.
Awesome. Thank you. Good afternoon, everyone. Again, my name is Antara Sarkar. I'm from Avia Health Innovation. I'm excited to be with you all today. Just for brief context, Avia Health, we're a services organization. We operate under a network membership model. We have about 50 plus health systems that we serve through our digital health strategy consulting services. So excited to be here with you all today as we dive into home health diagnostics. This is an area that has specifically gained a lot of traction with our health system members. A lot of the work that comes across my desk day in and day out is helping health systems grapple with the challenges that they're having as it relates to quality access and coordination of home health diagnostics. So very relevant work here. And just to set the stage a little bit, if you want to move to the next slide, I think it's abundantly clear that the US population is aging. There's a significant portion of our population that suffers from multiple chronic conditions, and we're seeing and treating patients that are more complex than ever. Just to name a few stats to demonstrate kind of the gravity of the issue, by 2060, there'll be approximately 95 million people above the age of 65, which is expected to be about 23% of the US population. In addition, the polychronic patient population in the US is projected to increase to 83 million people by 2030. So I think it's clear that the supply of this care, we cannot meet that demand that we're seeing. And so we ought to think through new creative care models, leveraging technology as a way to really close this gap. Given this aging population and the increased number of polychronic patients across the nation, we've seen a real push for more decentralized care delivery, spanning sites of care that are well beyond traditional hospital settings, for example, into the home. And so making options like remote patient monitoring and home health diagnostics a really more accessible and convenient care option to manage some of these chronic conditions. We'll see in the next slide that this shift of care kind of moving into the home is really driven by rising consumer demands. A lot of our consumers have very high expectations given the convenience that they experience with the Amazons and the Ubers of the world. But the good news is that these patients are more accepting and willing to find new ways to receive care, again, outside of the traditional ways of receiving care in the four walls of a hospital. A survey suggests that 44% of consumers are actually willing to share personal health data with healthcare organizations, which is actually 2 times the rate for technology or retail organizations. We've also seen an increased appetite for remote monitoring and home health diagnostics through an increase in remote physician consultations to about 85% in a post-COVID world. We've seen about 70% of consumers are interested in receiving healthcare at home, which is compared to the 56% in 2021. And the patient usage of RPM has increased from 5% to 20% post-COVID. So I think these trends are really a good, strong indicator for the appetite for receiving care in the home and non-traditional hospital settings. So I just wanted to touch upon that and how the space is really primed for growth based on those rising consumer demands and the shift in the population demographic. Again, I want to say congrats to all the folks on the line that are committed to improving the home health diagnostic space and chipping away at a very complex issue. Looking forward to hearing the discussion. As I close out here, though, I do want to add, as it relates to Avia and the work that we do and how we can help you all, in addition to the consulting services that we provide. A few years ago, we launched Avia Marketplace to help health system buyers across the country really select digital health technologies. So now about 70% of those hospitals and health systems really trust Avia Marketplace for their technology selection. So this year we launched buyer intelligence for solution companies like yourselves, like our finalists that are on the line, to find active buyers. And so as a token of appreciation for all the effort companies have put into this competition, we've provided free access to buyer intelligence. You should have received an email from Melissa regarding the free access. But please reply to that email or feel free to reach out to me or Melissa with any questions you may have. Just wanted to mention that. And thank you again, everyone. Looking forward to the discussion, and I'll pass it over to Mark to take us through.
Excellent. Thanks, Tara. So thank you, Avia. They are they're a key sponsor, but actually they actually offer really cool service. Been using it. And if you're looking to basically find that next customer, you probably want to just, dig in a little more to what they have to offer. Okay, we're back. So let's really talk about getting going here. And we're going to do our sort of a round robin. The first thing how we start with, we're going to go company by company and start with our best of class companies. And so this is going to be 45 seconds. Who are you? What's your superpower, and why should you win this award? And we're going to start with Antoine from Withings Health Solutions.
Hey, good afternoon, Mark. Hello, everybody. My name is Antoine. I lead Withings healthcare division. For those of you who don't know us, we invented the Smart Scale 16 years ago, and we've been bringing connected health devices to the market since then. We've helped about 10 million people on their journey to better health since our inception through a wide ecosystem of connected health devices. We expanded in the healthcare space 5 years ago to help care team remotely monitor their patients. And what sets us apart, why we think we should win, is really our deep understanding of consumer behavior. We come from the consumer space. We understand the end user. We understand what makes them tick. We understand how to find our way into their daily routine and bring this data back to care teams.
Sweet. Well, that's great. Thank you, Antoine. Next up, Constant Therapy Health, and that would be Vera.
Constant Therapy provides digital speech and cognitive therapy to patients at home. This enables patients to be getting continuous therapy, which is typically about 5 times more therapy than they would otherwise get. These are stroke, dementia, brain injury type of patients that also leads to continuous monitoring of their cognitive health. And our superpower is really that we're enabling not only patients to get that at home, but enables clinicians to monitor the patients, really practice at the top of their license, and reduce clinician burnout as they deliver care to patients at home. And to date, we have delivered over 275 million exercises to patients, most of them at home. And we have partnered with some of the large home health providers, delivering our solution to enable these types of patients to really get on their journey of independence and recovery.
Great. Okay, Jordan from Validic. Let's hear it. Let's hear the story.
Hi, everyone. I'm Jordan with Validic. I've been with Validic for about 6 years. I would say that our superpower is over the last decade, we've developed the largest and most expansive health IoT platform in the market. And over the last 8 years, we have designed and launched and scaled the largest remote patient monitoring program in the country, maybe in the world. We specialize in, and again, our superpower is in lighting up the EHR clinical workflow with data that is collected in the home or in a patient's daily life. And so we have successfully scaled remote patient care to many patients across an entire health system, and many health systems partner with us to bring that data into the clinical workflow. And so we've had a dramatic impact on folks' ability to manage their chronic conditions. And we think that programs like this at scale could dramatically influence folks' ability to get well.
Fantastic. Short and sweet. Next up, Adam Russell from Healthy.io.
Hi, Mark. Hi, everyone. Yes, Adam Russell, VP Strategy and Partnerships at Healthy.io. Healthy.io has built a program that enables the identification of kidney damage in the home and then engages that patient to take the appropriate next action. We do this using this kit and your smartphone camera. When combined, turns the camera into a clinical grade medical device, allows someone to perform a test in the home without their sample leaving the home and without the sample going to a lab. Our superpowers is we transform CKD, which is 90% underdiagnosed, to getting people diagnosed, getting people activated in their care within minutes, and driving them and engaging them in the broader kidney health to improve outcomes.
Perfect. Last up in the best of class category is Adherium, and we'll hear from Luke.
Hi, Luke Galera, Director of Strategy and Sales Operations at Adherium. So Adherium's has a Haley Smart Inhaler technology platform with a portfolio of smart sensors for asthma and COPD inhalers. And our superpower is the enhanced data that we collect from these devices to ensure the patient's taking the medication at the right time and ensuring that the patient's taking the medication correctly. Over 90% of patients have consistently been proven to not take their medication correctly. And our device can give the insights necessary to ensure that the medication is properly being delivered to the lungs.
Perfect. Okay, we're going to stick with the best of class companies. I'm going to turn it over to Paul, who's going to start off and start firing away the questions.
Sounds great. Thanks a lot, Mark. So let's start off first with, I think the impact. So, we want to know, like, what is going to be what's the big change? What's the big impact your company is going to make on patients in this space? If you are, I know most of you are successful already in different ways, but again, like, what is going to be the biggest long-term impact that you're going to look back and go, we did that? So we want to start off with, should we go in order, Mark, with start?
Yeah, that makes
it things first.
Sure.
Things first, excuse me.
Did you say we things first?
Yeah, let's go with things first.
All right. The biggest impact and what we look back and say we did that is the impact we had on early prevention, on prevention and early detection and diagnosis and pretty much the entire care pathway to enable both patients and care team to better understand what happens in their daily life with a variety of chronic conditions. We have solutions for pretty much every single chronic condition you can think of to help them see this rising risk, better diagnose earlier, understand the complications. So really think that our long-term impact will be in helping to prevent chronic conditions and their complications.
Let's go to constant therapy.
Yeah, so and I think many of us here would agree that the brain is probably the most important organ of our body, and our impact is really around enabling that cognitive health for patients. And as we know, with the aging population, this becomes a bigger and bigger issue. So we are really truly enabling patients to gain independence, whether it's a dementia patient, the millions of dementia patients, or stroke patients or brain injury patients, to be able to get the necessary intervention and monitoring to enable them to either improve if they are able to improve or maintain cognitive function so they can be more independent at home for longer. That's really significant in terms of both from a cost standpoint, as we look at the cost of healthcare for that population over time, as well as in terms of the quality of life that quite honestly, patients, these patients deserve and need.
Okay, I'm gonna change it up here for a second. I'm gonna go back to Withings and I'm gonna ask a different question because I know we don't have a ton of time, right, Mark? So I want to make sure we make the most impactful thing for the judges who are listening too. So I'm gonna go back to Withings, then we'll go back to you again. But let me change the question up here. So I want to talk about evidence that is really compelling. The evidence that you're able to point to, that you've collected, that is going to, again, justify why your company is going to make a big impact. So what's some of the evidence? What's something that's been perhaps convincing, again, to the payers, the health system, somebody who's writing the check? So let's go back to Withings again. What data are you providing? What evidence is it that's really resonating with the person who's writing the check, whether it's payers or somebody else? So let me go back to Withings on that.
Yeah, for me, the evidence is about being able to generate data in the long run to empower these care teams to understand what happens with these patients. If you look at Withings' history, we've helped 10 million people on their way to better health. We've detected 2 million episodes of AFib, for example. Researchers have used our devices and our data to demonstrate the variability of AHI in sleep apnea. Over 60,000 users in a published study. They've analyzed 12 million nights to show that the likelihood of misdiagnosis in people with sleep apnea can range between 20 to 50%. So it's really about how do we use this data to demonstrate the impact we can have, but also on the care team side. So in the healthcare space, how do we empower these care teams to deliver better outcomes? So it's not us. It's us empowering great people to do great things. And if I think of a few hospitals we've worked with recently, some of them have decreased systolic blood pressure by 20 millimeters of mercury around the high-risk patients. I was talking to another one that that saved 1,300,000 PM in their ACEO population after a CHF program was implemented. So it's really about showing both better outcomes for patients and better economies and financials for the system.
Let's hear data and how it's impacting and directly impacting patient care and outcomes. So let's go back now to, we'll go back to constant therapy.
Yeah, so there's several clinical studies that have shown improvement in patient outcomes on standardized tests like MoCA and other cognitive tests for stroke and dementia patients using constant therapy. So in addition to that, what we have seen is the program is already being used by patients at home. We have served over 700,000 patients now through our platform, over 275 million exercises done. And specifically in terms of cost impact, if you look at dementia patients, one of the studies at the VA has shown that promising results for patients being independent for 6 months longer using the program compared to what they would have otherwise seen for these patients. So that translates to about $24,000, $12,000 in cost savings in terms of the cost of care for these types of patients. Recently, one of our home health provider partners showed that they're able to save about 15 to 20 minutes per patient session in terms of the provider's time. That is significant because it saves about 1 hour literally per day for a clinician in the home health scenario in terms of providing care. That leads to more patients being seen, less clinical burnout, et cetera. So significant cost impact both from a provider standpoint as well as from a payer or patient's quality standpoint.
All right, Valdic, let's go into Valdic.
Awesome. Okay, so Validic's proven success to deliver outcomes for many years now. Actually, we've consistently delivered positive clinical outcomes. I'm going to cite a few here. So we are Again, as I mentioned, running the largest remote patient monitoring program in the country. We have over 400,000 patients enrolled all time, with close to 150,000 active at any given time. In those programs, we've found that patients with type 2 diabetes within 90 days have had a 1.2% reduction in their HbA1c. We've also found that there has been a 12% drop in systolic blood pressure, so stage 2 to normal ranges within 45 days of being in program. We've also run a heart failure program with an advanced primary care organization, where they found in a controlled study a $1,400 per patient per month, or per member per month, reduction in the cost of care. We've also have been working on a post-acute discharge to home program with a national IDN that has led to, on average per month, 84 bed days saved, which equates to around $350,000 per month in savings, roughly $4 million annually. And so some really hard facts on both clinical outcomes and some of the financial benefits of discharging folks early into the home. And that doesn't even start to scratch the surface around clinician efficiency, time saved, other things that stem from having access to, you know, home health data in the clinical workflow. And so in terms of making an impact, I'll just say, like, we provide the tools for patients to understand their health and to know what to do next. Most patients are not satisfied after leaving a visit with their provider. And so we enable the continuum of care. We also make it easier for clinicians to take care of their patients in the home.
Okay, great. And by the way, I'm going to do a follow-up if we have time on an anecdote of an impact you want to talk about in particular. But let's go on because of time to Healthy IO. So Adam.
Yep, thanks, Paul. Look, CKD, 35 million Americans have CKD. 90% of them don't know they have it. They're unmanaged, they're undiagnosed. A third of people that start dialysis crash into dialysis without having a prior diagnosis. Dialysis means you're strapped to a machine most of the day, and it costs $250,000 plus per patient per year. This program, we've demonstrated, we just had a big rollout with Geisinger. Geisinger were able to screen 20% of their patients. They're a sophisticated IDN, 20% of their at-risk patients were screened. We sent our kits to people that were unscreened and got 53% of them screened. Keep in mind, 90% of people are undiagnosed in the US Pop Health, 20% are screened. We need to transform screening in kidney disease, and we've demonstrated we do that through Geisinger. We had a program with Affinia in a federally qualified health center, underrepresented communities in St. Louis, got over 40% of them tested, 90% back into care for follow-up and diagnosis. We've screened 1 million patients globally. This is transformational to CKD, and we need interventions that are transformational in CKD to make a difference and an impact on patients' lives.
Okay, great. And let's go ahead to Adherium.
All right. So we've been used in over 100 studies over the history of the company. And one in particular showed that our solution led to an 80% reduction in asthma hospitalizations in children. So if you're just looking at hospitalization costs in this particular subset, we estimate that would represent more than $300 million in annual savings. And that doesn't even come into impact the missed work days and missed school days that these underserved communities are suffering from. If we were also to replicate that in the larger asthma population as well, there's 700 million in savings. There's millions and billions of dollars being spent on asthma and COPD. COPD tends to be a little more expensive. And even in looking at some of our studies that suggest a 35 decrease in hospitalizations, if you apply that to COPD, $1.9 billion in annualized savings could be the result. And so we continue to monitor and look at the data of these patients to make sure that they're using it correctly and nudging them, reminding them to take the medication, because adherence is such a critical aspect to control this disease.
Thank you, guys. So we have almost twice as many rising star companies. That's why I wanted to, really cut it off. We're going to do same format we did before. So we're going to start with Kakarian Health with Chuck. And Chuck, you're going to go first and give us your little pitcheroo.
Mark, thank you. I tried to change my name. Chuck had an emergency, so I stepped in from him. I'm Brandon Hamilton, Vice President here at Circadian Health. Thank you. So Circadian is a virtual first specialty medical practice focused on delivering high value care. We offer services working with payers and at-risk providers in cardiology, endocrinology, pulmonology, and sleep medicine. Our expertise really lies in keeping type 2 diabetes, heart failure, and COPD patients out of the hospital.
Okay, awesome. That's fantastic. Next up is MindStep. Federico, take it from here.
Hello, everyone. Good afternoon or evening. I'm Federico from MindStep. We are a digital mental health assessments and care platform for health insurers and providers. We are the front door to services that are in huge demand, but are currently disjointed and not scalable enough to meet that demand. So our superpower is to bring people to the right care at the right time and for the right value. We do this by providing clinical assessments for the 12 most prevalent mental and neurological health conditions that have been trained on over 200,000 consumers and optimized based on that data. We provide digital care that is shown to improve outcomes in across all these conditions. And we integrate with the services of the insurers and providers to provide onwards care and an end-to-end solution. By doing so, we improve access to care, we improve outcomes in 9 in 10 patients, and this leads to a 40% reduction in costs of onwards care, which provides scalable value for our solution.
Perfect. Thank you. That's perfect. Next up is Sonar MD, and we have Beth Hauk.
And you pronounced my last name correctly, which is extra points. So Sonar MD, we drive better quality of life and outcomes for patients with inflammatory bowel disease. So because not everybody deals with this on a daily basis, this is different than IBS, which is irritable bowel syndrome. This is the overarching title for patients with Crohn's disease and ulcerative colitis, which are really high cost chronic diseases. They cost about 5 to 6 times what the average patient costs the payer. We deploy a value-based arrangement. We do not disintermediate the patient's relationship with their physician. And I would call that our superpower. And because we do that, we are able to drive about 80% engagement rates with our patients, which drives really significant outcomes because you certainly can't drive behavior change and catch people from deterioration if you can't engage them. So we're really proud of that.
Nice. Great pitch. Next up is Epitel. Mark, you're on.
Hi, everyone. I'm Mark Lenkula, CEO and founder of Epitel, and we have developed the first wireless patch for recording EEG that we call REMI. And REMI uses 4 of our wireless wearable sensors that can be placed on the scalp below the hairline by pretty much anyone for remote interpretation by a neurologist. So REMI is discreet. It allows you to go about your daily routine, unencumbered by traditional wired tethers and the gauze head wraps. REMI is FDA cleared for up to 30 days of use, continuous use outside of the hospital. That includes our AI automated seizure detection software. Whereas a traditional ambulatory EEG kind of maxes out at 3 days, your chances of capturing these rare events like seizures is pretty difficult with the gold standard. So I'd say our superpower is our AI for automated seizure detection. And our AI is really meant to take weeks and weeks of EEG data and convert it into that clinically actionable information that can be consumed by a neurologist. So in this case, our AI is meant to make it easy for that neurologist to really determine, is their patient experiencing these seizures at home, very quickly. And so now weeks and weeks of EEG data can really be reviewed in a matter of minutes.
Perfect. That's great. Next up, HeartBeam, and we've got Rob Eno.
Thanks, Mark. I'm Rob Eno, the president at HeartBeam. What we've developed is this, an easy-to-use credit card size 12-lead EKG that's completely cable-free. And so the problem is that a 12-lead EKG is needed for heart attack detection and detecting complex arrhythmias, but that requires multiple external electrodes. It's really not suitable for a patient to use or apply at home. And then most of the wearables and at-home ECGs you're aware of are reduced leads, generally one lead, so they really aren't appropriate for detecting heart attacks and complex arrhythmias. So what we do is we collect the heart's electrical signals in 3 orthogonal axes and then synthesize a 12-lead ECG. So our superpower really is allowing patients to have a 12-lead ECG with them at all times, fits in the wallet, and really going after a number of things. First of all, detection of complex arrhythmias and heart attacks, where the average patient at home delays 3 to 4 hours before seeking care, mortality rates are 40% higher, but longer term can go after monitoring for chronic conditions and even screening as well.
Perfect. That's super tight. Next up is Rune Labs, and we got Brian. Good to see you again.
Rune Labs, good to see you, Mark. I'm Brian Pepin, founder and CEO. Our superpower, I think, is being really deep in Parkinson's and understanding it really well. Parkinson's is the second most prevalent neurodegenerative condition after Alzheimer's, and it is the fastest growing, with over 1.2 million diagnosed people in the US. Also a very underserved population that is 90% Medicare eligible. We have a flagship product called Stride PD, which is an FDA-cleared digital platform that uses proprietary kind of data and models that we have that are Parkinson's specific to wrap around a patient's care at home in between clinical visits, but also bridge different types of data into visits. The kind of two things that we do with that platform are offload entire elements, low risk, routine elements of people's Parkinson's care plan, as well as manage risk. We recently released health economic results from our work with Kaiser, who's one of our largest customers. We have about 10,000 patients using Stride PD every day in 150 clinics, but Kaiser is a large group. We're seeing, we released this on Monday, 43% reduction in all-cause emergency room visits. That's kind of the big top line result. There's some other good ones, but that alone represents a $4,500 annualized cost savings. And it's also just great to keep patients out of the ER because people with Parkinson's do not do well in there. And the last thing that I'll add is we have had success now with over a dozen pharma clients leveraging our network and the larger amount of data that we have and the kind of the unique data sets that we have and bridging that into clinical development at phase 1, phase 2, phase 3, and phase 4 to help folks run radically more efficient trials that can help bring some much needed new Parkinson's therapies to market.
Great, thank you. Next up is Day, and we've got Valentina.
Hi everyone, super excited to be here and what fascinating pitches so far. I'm Valentina, I'm the founder and CEO of Day. We've developed the world's first diagnostic tampon for at-home STI, vaginal infection, and HPV detection. The reason why we did it is because gynecological health screening is notoriously incredibly uncomfortable, and as a result, women avoid it. In the context of HPV screening and cervical cancer prevention, this is particularly important because when caught early, cervical cancer is entirely treatable. The superpower that we have is that we can contribute towards the eradication of cervical cancer as a disease within our lifetime. The World Health Organization, the FDA have all recommended self-sampling. And with the combination of regular vaccination programs, we have the opportunity in our hands to cancel a type of cancer, which is one of the deadliest female cancers in the world. Our approach to go-to-market is both direct-to-consumer and B2B, which enables us to have multiple touch points with our patients, both delivering directly to their homes, as well as through their doctor's offices, retail, etc.
Excellent.
Thank you.
Super tight. Love it. Next up is Bodyport, and we've got from Bodyport, we have Jay Pandit.
Hey, everybody. So this is Jay Pandit, the Chief of Clinical Strategy at Bodyport. Bodyport is a congestion monitoring solution, which is a hardware software platform that we have. We know that 25% of all hospitalizations are caused by congestion that leads to symptoms. And so that's what we're trying to crack at. Our solution is FDA approved, and in our larger multi-center study, we've demonstrated that we can actually detect congestion 2 weeks prior to actually weight, which is known as a lagging indicator. And the plan here is to go and expand into a disease, go start in CHF and then go down the pathway of CKD and other disease solutions. And so excited to talk about it further.
Great. Thank you. Thank you, Jay. Last up of our Rising Stars is Starling Medical, and we have Hannah.
Hi, thank you. My name's Hannah, and I'm the co-founder and CEO of Starling. We've developed a Class 1 toilet indwelling medical device that uses UV vis spectroscopy to scan your urine for chronic conditions every time you use the bathroom. And our first module is on the market today for monitoring the risk of urinary tract infections. So our superpower is that our product is completely seamless. It's hands-free, passive, reusable. It requires no change from our patients' daily habits. And so far, we're actually seeing our patients use our device about 3 to 5 times a day. The other part is really how we built our software and data algorithms around this technology in order for it to be more than just a wellness device. So our Starling program partners with providers and aims to directly prevent symptom escalation, hospitalization, and urosepsis. So through our Starling care team that partners with their existing providers, we're able to intervene with simple behavioral coaching, sometimes as simple as, hey, you need to drink more water. And after these interactions, we will actually see their risk score go back down and they don't end up getting an infection. So UTIs are pretty much the bane of any provider's existence, and we're here to really serve the neglected population and help prevent these infections from escalating.
Excellent. Super tight. Okay, Paul, handing it over to you.
All right, so let's talk about how your solutions have been adopted by care providers. Some of you kind of already did that, but let's get into some details. And if you've already talked about it a little bit, let's get into a detail, like maybe give me an anecdote about how a care provider in particular who's using your solution was impacted, or again, it caused them to increase usage, et cetera. So we'll start off with Circadian again. Give us a specific story, example, as quick as you can. So start with you, Brandon.
Sure. So our diagnostic solutions are helping providers truly identify critical changes in patient health a lot earlier, preventing avoidable hospitalizations. For example, we monitor heart failure patients for sudden weight gains, which can indicate fluid retention. When detected, our care teams can intervene quickly with medication adjustments to keep that individual from going to the ED or hospital.
Can you give us a specific example, like of one of your existing customers or somebody who you can tell, in one particular case where, whether it was pulmonary, whatever it was, but something you've done pulmonology, pick something.
So there's there's a health plan in North Carolina, or there's a health plan in Northern California where we've deployed a type 2 diabetes program. And there was an individual that was struggling late one evening with uncontrolled blood sugar levels. I actually think this was like Super Bowl time, and I recall the story from one of our medical directors. But our diagnostics alerted our clinical team of dangerously high glucose levels or readings that immediately allowed our care team to intervene, adjusting insulin and medication. This sort of action prevented the patient from developing severe complications such as ketoacidosis, hypoglycemia, which would have resulted in an ED visit.
Great, that's awesome. Thank you for that one. Let's move on so we have time for everybody. Federico, same question for you. If you need me to repeat, let me know.
That sounds good. So we are deploying as we speak MindStep across the NHS as a provider in England to run initial pilots across primary care networks where we know that GPs have 4 in 10 GP appointments are related to mental health in the UK and to the conditions that are intertwined with it. So we hope to reduce capacity and appointment burden through this trial and to improve clinical outcomes. We also, outside of the provider space, but with insurers, we are partnering with the global insurer to deploy the first globally available mental health solution, which is going live at the end of the month. I can't quite give the details yet, but it's a very exciting project.
Thanks. And are you doing, NHS is awesome. How about here in the US? Do you have a US?
We're not in the US yet. It's one of the plans for the near future.
Problem. All right, great. Thank you very much. All right, let's move on to Beth and at Sonar MD. So again, specific examples of how it's being used by, again, any partners, any hospital systems, anyone who you can talk, give us something specific about how it's impacting care.
Sure. So we were founded by a physician who deployed this idea of, we're named after a submarine, pinging patients between visits. And in January of 2020, we had to see whether or not we could take what he did in his practice and deploy that in individual practices that weren't affiliated with him, and do that in partnership with a payer. So we contracted with a payer in 2019 for a value contract that said if our IBD patients cost $40,000 right now and we can come in at $36,000, we'll share in those savings. So it was a full total cost of care contract with that payer. We then in turn went to the market and we signed 3 of the largest independent GI practices in the state and signed all of their patients, which was approximately, I think at our height, it was over 2,000 patients that we were managing their inflammatory bowel disease symptoms for. The whole crux of IBD is that it's a chronic disease that deteriorates without warning. So your goal is to stay ahead of it, which means, again, back to our engagement, our superpower, which means you have to really have those practices as your partners in both engaging patients, but also if they deteriorate, escalating them to the right type of care. So really proud, this past spring, we were able to publish a study based on 500 patients of that population that were continuously monitored by us for 2 years. In that case, we lowered ED visits by 45% over a control, and inpatient visits by 78%.
Yeah, that's pretty incredible in IBD. So that's fantastic. That's really great. Let's move on to Mark Epitel. Same question for you, Mark. So, I know there's so many things in seizures and things you guys have been doing for a long time. So give us some specific examples here. Tell us how you're making where you've made an impact in, particular examples.
Thanks, Paul. Yeah, the case that we are most proud of at Epitel, where we've made a profound impact on a patient's life, was literally our first commercial patient. So mother of 2 was having spells. And so her neurologist had her go into the epilepsy monitoring unit in the hospital for a 5-day recording session. And that session was inconclusive. And so she was just devastated because, she was still having her spells at home and just didn't know what to do. So some months later, the neurologist could have prescribed a 3-day EEG, but instead they prescribed a 7-day REMI study. And she was literally in tears because she didn't have to take off work. She didn't have to get a babysitter, all the things that would create a barrier to a successful study. And she even went to the beach with her kids during a recording session. And so our AI had detected 2 events towards the end of her recording session that just wouldn't have been captured on a 3-day EEG. The first one corresponded with one of her spells, and she marked it on the app, and it turned out to be an electrographic seizure that she was aware of. The second event actually occurred the next day at 2:30 in the morning, and she didn't even know it because she was sleeping. So this is kind of an example of being able to record those events that you just don't know that you're having. And so now her neurologist has the evidence that, okay, we know what her spells are and can properly treat her accordingly, much faster than we could have through the classic pathway. So that's our favorite story.
Great story. That's really, really, really great to hear. I guess the other question I would have for you again is, let's just following up on that really quick, which is, what can you do with Epitel that you cannot do with other systems that you might be able to use at home? Is there any other thing that you do that really separates you from the others?
Yeah, there really isn't anything out there for long-term home monitoring for neurology in this space that records EEG. And so we're kind of greenfield in that way. But really what makes it accessible and usable by a neurologist is being able to take all that data where nothing's going on and only highlight those sections where, yeah, take a look at this. This could be an event that you're looking for. Or here's what the patient marked. This is what they think they're having at home. Is there an EEG correlate? And so that's where it really, really shines.
Right. And you're wireless as well too, right? So, people, they can go about their life.
That's correct. Yes. It's wireless to a smart device, and then the smart device relays the data to the cloud. So everything is very seamless for the patient's perspective.
Terrific. Thanks, Mark. All right, let's move on to heartbeat. So, 12 lead ECG in your wallet, in your purse, whatever, that's incredibly disruptive, right? So give us some examples of, how it's impacting care already, if you can.
Sure. Thanks, Paul. So we are pre-commercial. We're in what we hope is the very final stages of our first 510(k) clearance. So let me just really quickly give you a piece of data and an anecdote. So the data we've published in JACC Advances last year, where we looked at the performance of our device versus a standard 12-lead ECG in detecting coronary occlusions. And top line was we matched performance, which was great. But what was fascinating is that we onboard our patients so we have an asymptomatic baseline. And we found with either a 12 lead or ours, that actually increases performance 30 to 40%. So what we found is if you go to an emergency room, you're often, if you're not a known patient, you have one ECG, we could potentially be 30 to 40% higher. But the anecdote I want to give is one of our engineers in Europe developing the system, and they have devices as we're fine-tuning the performance. He lives in a remote area, actually had chest pain symptoms, said, I guess I'm going to try doing this myself. He put it on. It was the classic telltale signs of a heart attack. He was able to go to the emergency room, get care, and got treatment so early that there was no heart damage. So it's great for him, great for the company, but it kind of a good sense of what the potential is for our technology.
It's a great story. That's a really good one. I love that it was somebody who's actually involved in the study, care provider. That's great. All right. Thanks, Rob. That was a really good one. So let's move on then to Brian at Rune.
Yeah.
Rune? So I say, make sure I say
Rune Labs. Yes.
Rune Labs. I want to make sure I said it right. Brian.
So, yeah, in our world, sometimes it's more important the things that a specialist doesn't have to do because there just aren't enough of them. So there's 600 movement disorder specialists in the US to 1.2 million Parkinson's patients. Most patients don't even get to see one. And so the combination of kind of access and data that we have in our platform, full EHR contacts, full medication contacts, continuous symptom data sensitive to the subclinical level has allowed us to, in an automated way, serve entire elements of the care plan. So we're, in any given month, about 5% of patients, we're identifying a need for them to go to their physiotherapy appointment. We're helping them close the loop on getting that appointment and verifying with them on the back end that that actually helped. About 5% of folks we're flagging that they're having some kind of hydration and diet issue that's interfering with their primary med uptake and increasing their symptom burden, and we coach them through that. So these are things that are low risk, routine, but nevertheless do clog up the workflow of a specialist. And by removing that, we're opening up specialist time, but we're also serving these things on demand to folks so they don't have to wait for their specialist to go see it. I think that's something we're really happy with. It also, because we're monitoring these folks, I mean, and these are like the really clear ones, about 2 to 3% of folks in any given month, we get flagged as super high risk. They're having an acute increase in symptom variants, falls, certain patterns that we know are associated with really high risk. There was one woman in particular who comes to mind who we recognize some of these patterns, these high variance symptoms. And what we're able to do, because we're opening up capacity, is triage her for a visit to her specialist. And so she goes in, and it turns out that she was sick with another illness that was interfering with her ability to take meds. And she was going to be in a fairly dangerous position based on her symptom burden, have a fall, possibly end up in the ER, possibly end up in the hospital. Fortunately, she was able to get to the specialist in that case, who was able to assess that and change up her meds such that she did not have those same dangerous symptoms when she came back and did not end up in the ER. So that, yeah, it's kind of two sides there.
And let me just follow up with one question for you. So, you said you've got, is it over 1,000 patients a day using it? Is that right?
10,000.
Sorry, 10,000. I was off by a very big important digit. So 10,000 patients a day using this. You gave a good example right there of identifying somebody who's super high risk. Are those patients who are using this daily? Are they ones who are there physicians driving the behavior, or are the patients on their own adopting this?
Yeah, our system works. There's a relatively close analogy to like an insulin management system that uses a continuous glucose monitor. So most of the coaching and data we're just delivering to the patients on their own and doing it in a way that's friendly to them, where we can interpret as much as possible, where they can take the actions they can take. And when we take the steps to connect to clinical care, or when it gets complicated or high risk, or it's something that their care team has like specifically asked for or specifically in their care plan. So 95% of what we do is with the patient and their caregiver. But that other 5% is still really important for those special cases.
Okay, really good. All right, thank you very much, Brian. All right, so let's move on to Valentina at Day. You gave some really good examples on that it's uncomfortable for screening, and and that not enough people are being screened, and we can eradicate cervical cancer. So that's a huge it's a huge opportunity, and doing it in the tampon platform, that's awesome, right? So the question I have for you again is the same one we've been talking before. Anecdotes. What can you tell us again about specific examples, either in the at any stage of development that you've seen where this is making an impact, and then we can abstract where you might go in the future.
Yeah, so I can give two very specific patient stories. The first one has to do with our HPV screen, and the second one has to do with our vaginal screen, which are both underlined by the diagnostic tampon technology. So with the first one, we had a patient with vulvodynia who had been avoiding her HPV and cervical cancer screens because she was finding them too painful. So with the Day diagnostic tampon, she was able to get screened for the first time, and actually identified that she did have a high-risk HPV strain, which was followed up by a cytology, which also came up positive. So she was able to start her treatment for cervical cancer earlier than she would have otherwise, because her condition prevented her from being able to take part in standard programs. Another thing beyond the HPV screening is the importance of detecting the exact vaginal pathogen which is causing the patient's symptoms, because vaginal symptoms are often very similar, discharge, burning, discomfort, and the sophistication of diagnosis is really subpar. So frequently we treat before we know exactly which pathogen is causing the condition, which leaves the patient stuck in a constant cycle of recurrent infections, dramatically impacting their quality of life. So we recently had this 28-year-old patient who for the past 10 years had recurrent vaginal infections. She was continuously treated, initially for thrush, then for BV, then again thrush, then BV. Her symptoms persisted. She couldn't find any solution. She couldn't exercise because her swelling was so painful. She couldn't have sexual intercourse. Her relationships were affected. Her self-confidence was affected. And in the last doctor's appointment that she had, she was actually prescribed antidepressants because her clinician believed that her symptoms were all in her head, because the clinician was prescribing the standard treatments for the vaginal symptoms that she was experiencing without any impact. She then used a Day diagnostic tampon and realized that the real pathogen that was causing her symptoms was actually ureaplasma, which is a perfectly treatable pathogen, with a simple course of antibiotics, which she was able to obtain. And for the first time in 10 years, she could go about her daily life without the constant feeling of discomfort and embarrassment caused by persistent vaginal infections.
Great impact. Okay, let's move ahead so we get these last ones in on time. So Jay, body port. Again, this, what you described earlier, 25% of all these visits are being caused by congestion that ultimately leads to these symptoms. So, and you proved you can detect 2 weeks in advance, that you can detect this 2 weeks in advance. So give us the impact. Where have you seen this already making an impact on care?
No, absolutely. So I can give you a specific case, but one thing I didn't get a chance to say was the superpower here is really the simplicity of this platform. It's the form factor is a smart scale that's taken to the next level with 3 different sensors within it. And the person just has to stand on it for 20 seconds and you get an impedance reading along with a heart rate as well at the same time. So, one of the things with patients who have multiple comorbidities is really figuring out whether they're wet or dry, whether they have too much retention or not enough. And so in this scenario, we had an 81-year-old participant who was in our studies, who was cachectic. So she was continuously losing weight, giving you the false impression that she was actually not retaining fluid, when in reality, the extracellular water was actually going up, and she would end up with heart failure symptoms and end up in the hospital. And so in this scenario, we were able to intervene again about 10 days before, alert the care team to start diuresis. And this can be also one of the things that we want to do in the application in the CKD space is, again, reduce, as Adam pointed out in healthy.io, reduce the number of people that crash into dialysis. If we can actually find folks who can ease into electively going to dialysis, that's a much better cost savings. So.
Terrific, Jay. Thank you very much. All right, let's go on to Starling. So Hannah, I love the smart toilet. We've seen lots of these before, but ultimately a lot of them don't gain traction. And I know that, UTIs, you're going after a good, that's one particular application that, I think is a huge opportunity for so many reasons. Do you have an an anecdote already that you can share with us in that particular case?
Yeah, so for our device, like I said, it's toilet indwelling, completely hands-free. So we're seeing really high engagement. I think that's a tribute to how seamless it is, but also how motivated these patients are. So UTIs are extremely preventable, but they can very easily spiral if they are neglected, which is sadly the case today. So we partner with providers, and one of our providers, we helped them do a study on their treatment cost for UTI patients. And we found that for just recurrent UTI patients that go in for, urinalysis when they think they have symptoms, it's about $400 per patient per month. However, once that patient gets hospitalized for a UTI, it skyrockets to about $15,000 for that patient that month. So we had a patient with that client specifically, where our nurse got a flag from our predictive algorithm that the patient, had a high risk for an infection. This patient had previously had urosepsis, really because they would get symptoms and kind of ignore it because they knew, if I try to go see my provider, it's going to take, 2 days for me to get in there. Maybe my symptoms will subside, and they actually had to get hospitalized. So now that they're on our platform, we actually saw, even before they had symptoms, that something was wrong. We saw they had higher components in certain areas in the urine. So we, called them, let them know through behavioral coaching, have you been drinking water? Have you been voiding regularly? What has your diet been? And we were actually able to implement some simple changes before they even had symptoms. And then later that day, when they used Urindex, our device again, just because they were going to the bathroom, we scanned their urine, we saw their risk profile go way lower. They didn't end up getting an infection. And, I can't say that we prevented it, but they didn't end up getting one. They didn't go to the hospital. They didn't get uroseptic again. So that's really where our secret sauce is that we do this loop before they even are symptomatic, because UTIs can be so prevented if you're really looking for it. And another example is, just since we are plugged into providers, if they do have symptoms, again, it's not the end of the world. We can get them in that same day, again, because our partner clinicians are now not inundated with all of these potential symptomatic patients. We're kind of handling the early triaging, and we just send them over the patients that are symptomatic and that need their treatment. So we're really just reworking how these patients go through the clinical pathway, so that the ones that need it go to their providers, and then the ones that we can just work with to prevent infections in the first place get the care they need.
Terrific. Thanks, Hannah.
So listen, guys, thank you very much. We've definitely captured some good content. This is exactly what our judges are going to need. We're going to be able to use this. This is perfect. I hope you've had fun. Here's what we've also learned. Let's make sure you guys connect. So many of your solutions are adjacent. There's a lot of things you can do together. It's tough enough out there to sort of, be going at this alone. Go at this together and really work with each other. Make sure you meet up at HLTH or wherever else. Really with that, thank you. more information is going to come in terms of what's going on in the program. We're on track. We're really excited about what's going to go on in Vegas. And with that, Melissa, I'm going to hand it over to you.
Hello, everyone. Again, thank you for joining us for this finalist session for our home health diagnostic category. Thank you to Mark and Paul for our hosts and all the wonderful conversation from our finalist company representatives. Obviously, everyone in the audience, please join us on October 21st at 1 p.m. at our pavilion stage at booth 3254 for our Rising Stars to be announced, and then at 5 p.m. on the disco stage for our best in class companies to be announced. And then obviously everyone is invited to come celebrate with us at Milo's in the Venetian. Hope you all have a great rest of your day, and we'll be seeing you in Vegas.